Okay, here we see the leukoplakia tissues, very thick and diverse. Here, look at the abnormal tissues. She had long-term antibiotic treatments, so superficial parts may be healed a little bit, but still there are leukoplakia islands here. Very thick leukoplakias. We see these floating particles in ultrasonography, and I'm checking the rest of the bladder. These are leukoplakia coming close to the ureteric orifice and some trigonitis here. And this is a healthy bladder mucosa. Here is a biopsy site, old biopsy site. Always, when do they do cystoscopy, the urology doctors pop in the bladder like this and they control the trigone. She is previously diagnosed as trigonitis, but still I can differentiate leukoplakia tissues in every part of the trigone. This is a normal part. Maybe there is a biopsy site, but usually biopsies are taken from the back wall of the bladder. So when I look to other sides of the bladder wall, this is the thick leukoplakia, and the part coming in contact with this trigone is this part in the opposite bladder wall. Here we see the abnormal red tissue compared to this side. Look here, normal tissue. This part, I think it's the part coming into contact with the trigone. Now I will empty the bladder slowly and will search if this part will come into contact with the trigone. This is the trigone. The source of the illness is this part. Now we are emptying the bladder. There is a reddish area, erythematous. These side walls are normal, but in middle, in the back wall, this is the diseased side. And I think that the reason of this disease is coming into contact, coming into touch with this trigone. Now I'm emptying the bladder slowly. These are the healthy tissues of the bladder. This part. Now this part is coming into contact. This is the trigone, leukoplakias. Yes. Look, when we empty the bladder, this part is in contact with the trigone. So I am filling it again. Okay, I will also fulgurate this area. This is left ureteric orifice, and just close to it there is a leukoplakia tissue. The infection go from here through the ureteric orifice. We put the marks for the borders, and we are fulgurating the ill tissues now. So these are the old biopsy sites, and we can see how new mucosa heals when it is biopsied. It's a little different than normal mucosa. This is a normal mucosa, this is a new formed mucosa over the biopsy site, and here also a newly formed mucosa. So we fulgurated this trigone area. These are ureteric orifice. The lesions come close to ureteric orifice, and they pass beyond the retrocoriferis, we fulgurated these areas, and then we fulgurated the opposite bladder wall that comes into contact and inflamed. The rest of the bladder, it looks healthy. It didn't bleed, which is good. The bladder capacity seems to be a little less than normal. There is a little lesion, it's not a dangerous one. I will fulgurate this. Capacity seems a little less than normal, but I don't want to distend the bladder. I don't want to crack the mucosal lines. And when I look to urethra, here urethra seems normal. When I palpate, I don't palpate any sciatic gland. There is no sciatic gland infection. Here there are some bleedings coming from urethra. It's bleeding from here. I cannot fulgurate urethra, so I have to stop here. It will stop by itself. These are normal bladder mucosa. This is normal. This is normal, and I have to look to vaginal part. This is cervix uterus. There is some inflammation, not too much. I will recommend her, if she has too much discharge, she needs a gynecological consultation, but it's not an extreme inflammation here. This is a normal vaginal discharge. Okay, now, and the vaginal walls are totally normal. This is cervix uteri, a little inflamed, but it seems normal too. And the vagina seems quite normal.